Hello all. Today we are talking about something that can silently cause blindness, glaucoma. It's often called silent thief of sight. To help us understand this better, we have Dr. 𝗵𝗶 ma'am with us. Doctor, welcome.
Thank you, Niharika. I'm glad we are discussing something about glaucoma, which is a silent thief of vision.
Doctor, what exactly is glaucoma?
Glaucoma is an eye condition which causes the damage to the optic nerve. It's the optic nerve which connects the eye to the brain. Most commonly, the eye pressure becomes high, and that is what affects the optic nerve. Yeah, the dangerous part is patients will not realize, or the people who are having glaucoma will not realize that they are having glaucoma. And the vision from the side starts declining first, and that's why it is called the silent thief of vision.
So how would someone know they have it?
That's a very good question, Niharika. In the early stages, they will not know that they are having glaucoma. When the glaucoma progresses, slowly they will have a diminution in their side vision, and slowly they'll have noticing difficulty in driving in dim light. And as the disease progresses, they will have tubular vision. That means it looks like as if they are seeing through a tunnel. That is a very advanced or end-stage disease. There is one type of glaucoma where they will develop redness, pain, vomiting, and sometimes they also have colored halos. And this variety is called the angle closure glaucoma variety. This one is very symptomatic. Otherwise, most of the other types of glaucoma are asymptomatic. That means they do not have symptoms. And that's the reason why exactly it is called silent thief of vision.
Then who is at higher risk, ma'am?
Anybody who is above the age of 40 years, who is having a history of diabetes, hypertension, and those importantly with a family history of glaucoma. And another important risk factor is those using steroids in any form. Steroids, I mean, in the form of nasal sprays, or it can be skin ointments, even if it is applied in the extremities like hands and legs. And those who are using high spectacle power, it can be high plus powers or even high minus powers. These are at high risk. And those with a family history of glaucoma are at increased risk for almost 10 times than the others who don't have family history of glaucoma.
Ma'am, then how do you diagnose it, ma'am?
Yeah, glaucoma is generally diagnosed by a very good comprehensive eye examination. Comprehensive, I mean, we will measure the eye pressure, then we'll understand how is the drainage part of the angle. We'll check the optic nerve if there are any changes in the optic nerve which is suggestive of glaucoma. We'll also do visual field test which will help us analyze how is the functioning of the optic nerve and understand if the side vision is lost. Then we also do scans to understand how is the optic nerve structurally. So it is a combination of all clinical and investigations which will help us diagnose glaucoma, and not one single test. And also that one normal report will not generally rule out glaucoma. So it's a very comprehensive examination, and we are not treating the optic nerve or the eye pressure. We are treating the patient as a whole.
Glaucoma be cured, ma'am?
Yeah, glaucoma cannot be cured, Niharika, but if it is diagnosed early, we can help preserve the pre-existing vision that we have. So glaucoma is essentially treatable but not curable.
Then what are the treatment options, ma'am?
Glaucoma is to reduce the eye pressure and preserve the vision that is pre-existing, like I said before. So we have three options. One in the form of drops, the other in the form of laser treatment, and the third is the surgical treatment. This is the most common treatment that we use generally, and most of the time patients get managed very well with drops. But only thing is that they have to use regularly to preserve the vision which is existing by controlling the eye pressures. When the eye pressures are not managed with the help of drops, or they are not able to tolerate the medications in the form of eye drops, we go either to laser treatment to buy some time, or the most definitive treatment here is surgery to control the eye pressures and help the patient preserve the existing vision. Treatment is usually lifelong, and stopping the treatment by their own is generally not recommended, and it is very risky because the eye pressure can go up or go higher uncontrollable when the drops are not being used.
For your fellow doctors, ma'am?
That's a great question, Niharika. Whom to refer? Yeah. Early referral generally helps us in bringing a difference in patient's life in preventing blindness. Please consider referral when there is progressive glaucoma, when the eye pressure is uncontrolled despite maximum treatment, and there is a normal tension glaucoma that is suspected, pediatric and secondary glaucomas, and advanced disease progress whenever the disease is progressing despite all kinds of treatment that is being given to the patient. High-risk patients need aggressive monitoring and an individualized approach in getting the pressures to the target level so that we can prevent blindness in them and achieve good quality of life in patients with glaucoma. Collaborative effort definitely improves the outcome.
Final message for our listeners, ma'am?
Yeah, thank you. So anybody above the age of 40 years, diabetics, and those particularly with a family history of glaucoma definitely needs a checkup to rule out glaucoma with a comprehensive glaucoma evaluation. That will bring a lot of difference in their life, thereby preventing blindness if they are suspected with glaucoma.
Thank you, 𝗵𝗃 ma'am, for giving us a better understanding. Hope so you all like it. Thank you so much.
Thank you. Namaste.